So today I'm going to be talking about the importance of moving forward in healthcare. I'm going to have a focus on mental health and virtual reality. I'm going to start off the presentation talking about a few general issues in the field. Then I'm going to move on to talking about the kind of impactful thinking that we can exercise in order to move to innovation and inspire moving forward in a lot of fields, including healthcare. I'm going to end my presentation with a few real-life applications of moving forward in healthcare, of innovation in healthcare. Starting off with general issues in healthcare, the first issue that I've listed is communication and collaboration between institutions. So in order to provide optimal patient care, it's really important that these different medical institutions communicate. And some of the areas in which there are bridges that can still be built are patient data. So that is in Canada, there are still issues with transferability and accessibility of patient data between institutions. But if you look at what's happening in Finland or parts of the UK, they're moving to a more digitalized healthcare system where they're using a lot of different technology to make healthcare more accessible, more transferable, but also protecting the privacy of the patient. The second area in which bridges can be built is the supply chain. And there has been a proposal to implement this in Ontario that points out some of the flaws in our system currently. The second general issue in healthcare is access to healthcare in rural or remote areas. Presently, there's a study that's being done in Alberta that's looking at the effectiveness of home virtual care solutions. So having healthcare from home. So this would eliminate the need for the distance when it comes to this issue. The third issue listed on this slide is personalized medicine. And this issue, when you look at it, you're bound to run into another field called epigenetics. And epigenetics is the inheritance of more than just the sequence of our DNA. So that's an important thing to look at when it comes to general issues in healthcare. The fourth issue that I've listed here is the toll on healthcare professionals in terms of mental health. So there are not a lot of support systems in place currently for healthcare professionals in terms of mental health. And this is not just a problem in healthcare, but also a problem in other areas like entrepreneurship and business. And this is not just a detriment to healthcare professionals, but it's also a detriment to the institutions in terms of finances and costs. Whenever healthcare professionals take a leave of absence or resign from the institution completely, that's the cost to the institution itself. Now I'm going to move on to general issues in mental health. So I've listed a few on this slide, but certainly there are more than this. The first one that I've listed is access to mental health care. Similarly, when I was talking about access to healthcare in rural or remote areas, particularly access to mental health care is an issue in those areas. The second issue that I've listed is stigmatization. So a lot of people who are mentally ill are hesitant to or even resistant to receiving the care that they need. And the reason for this, a lot of this is down to how we stigmatize mental health, and also down to the lack of education in mental health in our schooling systems. As a student going through middle school, high school, elementary school, I didn't really find that the healthcare courses that I was taught really had a focus on mental health. The third issue that I've listed here are preventative measures and strategies. When we were talking about the toll that it takes financially on institutions when healthcare professionals are burdened by mental health, that could be removed. That cost could be removed if we had preventative measures and strategies. However, in Canada, we have more of a reactive model than we do a preventative one. What that means is when we have a problem, then we deal with it. That's the general philosophy. The latter two points talk about the diagnosis and treatment of mental health issues. So presently we have a lot of effective methods in place, things like for diagnosis, the DSM-5, and in terms of treatment, we have various therapy programs and drugs that work very effectively. That's not to say that there's no room for improvement. When you take treatment with drugs, for example, if you take the drug for Parkinson's disease that's commonly administered, the problem with Parkinson's is that there's a lack of a chemical in the brain called dopamine. And so what that drug does is it increases the amount of dopamine in the brain. And that increases the amount of dopamine in a certain structure, but it also increases the amount of dopamine in other areas of the brain that are not experiencing a lack of dopamine. So taking this drug leads to severe side effects, things like developing a gambling addiction. With the latest research and new emerging technology, we can see that there are alternative and perhaps more effective ways of treatment and diagnosis of mental health issues. Now, these issues have always been here, but they've just been exacerbated by the global pandemic. It's said that the global pandemic, that's COVID-19, has also brought along with it a second pandemic called the mental health pandemic. So not only have populations experienced an increase in mental health issues, but also we can't just walk into a physical consultation and access healthcare like we did before. So the way that we've accessed healthcare now is a bit different. Also, healthcare systems around the world, they've been facing a lot of stress, and as we've seen through the internet and through social media, it's been really devastating to see. So looking at these circumstances and these issues, it's clear that we need new ideas, new plans, and new solutions. And for the next portion of my presentation, I'm going to be talking about the kind of thinking that we can exercise in order to move towards this kind of solution. There are three components to this process. The first one is being inquisitive. To be inquisitive, we need to explore what we don't know and the vast amount of knowledge that is available to us. Every day there is new research that is being done, new endeavors that have succeeded, and the facts that we know are changing. And as a student, I find that a lot of my academic life is centered around textbooks and understanding the theory and the concepts, which is very important, but it's also important to take the initiative to look at the world around you and see the recent advancements for yourselves. So how can we engage in being inquisitive? Really, it's about accessing the resources that are available to you, accessing the books, looking through the internet. And while we do this, we have to remember that it's up to us to decide what is credible and what is not. The second component of this process is being collaborative. If you look at the products that are being launched around the world or research studies that are being put forward, partnerships are central to each and every one of those initiatives. They're central to innovation, business, and thought leadership. Any initiative requires some kind of outreach component, really. So at the beginning of this presentation, I was talking about this study in Alberta that was testing the effectiveness of home virtual care solutions. I wanted to show you that study, that simple study, requires seven collaborators, 7 companies and organizations that had to come together in order for this study to happen. That just goes to show how many pieces have to come together, how many people have to work together to make something impactful happen. So how can we go about being collaborative? Well, we're sitting in an example right now. These PTG meetings are a wonderful example of collaboration. Every Saturday we come together, we share knowledge to individuals, and we learn things that we did not know. This wonderful transfer of knowledge, it's a perfect example of collaboration. The third component of this process is one that I feel is least exercised, but also one of the most important components. So we all have our areas of expertise, and those areas of expertise, they allow us to look at the world through this unique lens. They allow us to give unique insight and drive ideation in our own way. However, there is no one unique lens that is going to allow for such a holistic approach, which is what a lot of people are after right now. For example, if you talk to insurance companies, they'll tell you that they're tired of going to a million different places to get what they need. They would like to be able to go to one place to get what they need. And to make these sorts of all-in-one solutions, you really need people of different backgrounds, of different disciplines to come together to drive that solution. You need to be interdisciplinary. And the second point on this slide really drives that in order to move thought leadership and ideation into application, you need to be interdisciplinary. Research, there's a lot of good research around this world, and research is great, but it's a beginning. It's not a final product. We need people to code, to develop, to build. We need people to conduct outreach, to market, and there's no one single person in this world that will likely do this as well as a group of people with relevant areas of expertise coming together to drive this solution. So how can we engage in being interdisciplinary? Really, at the heart of being interdisciplinary is making connections between seemingly unrelated things, realizing that your areas of expertise are not just a stranded island. There are bridges that can be built in areas of overlap. So I put an example of that on this slide. I was reading an article called Big Data from Small Data, Data Sharing in the Long Tail of Neuroscience. And what this article was discussing was that there are a lot of small labs in this world, and they're making a lot of data. They're producing a lot of data, but that data does not get put into a space where it's accessed by global researchers. It doesn't get put into a space where we can access it. It just goes into the waste. And in this world, having a lot of data is really good because it tells us what works, what doesn't work. That's really important to know. So I thought it's unfortunate that all this data is going to the waste. At the same time, I was looking at identity, all these different facets of identity, all these different components of identity. And I found that identity gave a sort of credibility. And this sort of credibility, if small labs could harness this sort of credibility, perhaps they could put out their data into a space where it's accessible and it doesn't go into the waste. So this is just an example of connecting two seemingly unrelated things and an example of being interdisciplinary. And these three components really flow into innovation. And innovation is really important. It allows us to build, to move forward, to present unique solutions. And in times like these, where all the gears are shifting, we need new solutions, we need innovation. Now, when I think of the word innovation, I think of the word new. And a lot of people are not really susceptible to new. They're not really accepting of new. And it's understandable. We've been living with prescription drugs and physical health consultations our entire lives. It's really hard to imagine anything different. And in fact, I encourage you to be hesitant in accepting innovation, to be critical for innovation. And that's where the thinking process comes into play. If you're inquisitive, if you're collaborative, if you've been interdisciplinary, you can look at this innovation and criticize it for yourselves. Particularly right now, in times of COVID, the organization, the FDA, is relaxing some of its regulations, and what that allows is some of the products to move a bit more easily through the approval process. And so during this time, there are a lot of products that are being advertised for mental health. And if you've been inquisitive, if you've been collaborative, if you've been interdisciplinary, you can look at these projects and at these products and judge, are they really giving you what they say that they're giving you? So being interdisciplinary, being collaborative, and being inquisitive doesn't just allow you to innovate, but it allows you to respond to innovation appropriately and also critically. In the last portion of my presentation, I'm going to be talking about a few applications of this sort of innovation and this sort of thinking in real life. The first area I'm going to be talking about are virtual labs and think tanks. A think tank, by definition, is a sort of research institute that produces research and advocacy for a range of topics. And virtual labs in this time are really needed because in this time, laboratories cannot be physical. Everybody has had to learn how to go virtual. The first example here is the Grey Swan Guild. So this is a group of individuals around the world who come together in light of COVID and discuss what the world is going to look like after COVID, what problems are there going to be after COVID, and how can we solve them. The AARP Virtual Innovation Labs, they're a virtual lab that has a focus on virtual reality, but also seniors. The Co-Ideation and Logistics Institute, they have a focus on logistics and incorporating students into that sort of thinking. And the fourth example on this slide is Applied VR. This is an important example because they've really mastered how to engage in virtual labs during this time. They're actually running their study right now to test their product, their virtual reality product for chronic pain in a virtual setting, so there's no on-site research going on. The second component are healthcare systems, innovation and infrastructure. At the beginning, I highlighted some general issues in healthcare, and especially during this time where we can't physically go to a doctor's office, we need this sort of innovation in our everyday healthcare systems. So Well Health and XR Health are really important in providing virtual solutions. Well Health is actually partnered with a lot of leading institutions like CAMH, and XR Health has innovated an entire hospital to go virtual. So these are really great innovations. And the last area of applications that I would like to talk about is virtual reality in healthcare. So virtual reality is where you have a computer-generated environment, a 3D environment that you can seemingly interact with in reality. So the examples that I have here, the first one, Endeavor X, was the first video game to be approved by the FDA, and it's a treatment for ADHD. It was created by Adam Ghazali with Akili Labs, and it has a strong neuroscience basis to it. The second example, Helium, it is a product that has a lot of focus on stress and anxiety, and it uses your vitals, your biomarkers, and your biometrics in order to change the simulation as you go along. So this is what I wanted to discuss in my presentation. I hope that you have understood this way of thinking and that you've seen that how it can be applied in the real life.